Welcome to The Culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are The Culture. Welcome to The Culture. We have a very exciting show for you today. Joining me, I have Ruban Roberts, President of the Miami-Dade branch of the NAACP. Welcome, Ruban.
Thank you for having me and welcome.
Thank you. Also, we have Ms. Annie Neasman, President and CEO of the Jessie Trice Community Health System. Welcome.
Thank you, Jessica. Thank you for having me.
I would like to start with you, and if you would please give us a little more insight into the history and the services that are provided by Jessie Trice.
Thank you, Jessica. I would like to say that I am delighted to join you today on behalf of the Jessie Trice Community Health System. We are now in 2017, we celebrated 50 years. So we will be 53 years old in June. In this community, we were the first federally qualified community health center in the state of Florida, and we were the 5th in the nation.
Wow.
And Jessie Trice, which was then called Economic Opportunity Family Health Center, was really developed because the community needed health care. And also the residents, actually Dr. Lynn Carmichael and Dr. Joyce Simpson, needed a place for their residents, their family medical residents, to provide care. So it was a win-win for both the community and the University of Miami. So in 1967, we were born. We are governed by a 51% user board of directors, and that means that our board of directors, 51% of them do utilize our services. So the residents of Central and Northern Miami-Dade County, which is our catchment area, are able to get family practice services. That means for anywhere from the very young to the very old. We have generations of patients, as you can probably imagine. We do obstetrics and gynecology. We do pediatrics. We also have a residential women's substance abuse treatment center, which is a 24-hour center, wherein women, it's a 40-bed center, and women can bring their children up to 2 years of age. And last year, we provided services to over 45,000 individuals. We have 11 what we call comprehensive primary care sites, and we're also in 40 Miami-Dade County public schools, as well as the Florida Memorial University. We service their students for care. So we are very excited about being in this community, and we are very proud to be providing those services to the citizens and residents and visitors of Miami-Dade County.
Mm-hmm. Thank you so much for giving us that overview. I want our conversation to be as it relates to Blacks and COVID-19, but I didn't want to start that conversation off without setting the platform of the opportunities and services that the Jessie Trice Community Health Systems bring. I'm going to bring Ruban in on the conversation. Blacks, COVID-19, the numbers are pretty startling. What does it look like from your view?
Well, this is a very serious matter. In fact, we received data from the county and the city of Miami, and most of the zip codes and predominantly or high volume Black communities show hotspots. And so we really, in terms of Black Miami, really need to be concerned about going out without protective gear on and sheltering in place. The Miami-Dade branch of the NAACP encourages everyone to shelter in place. And for those essential employees and we who are out there working in the healthcare industry and those who are providing whatever essential services that we need, we definitely commend you for doing that work. And we want to support you as much as possible. For those who are doing that work, we are hoping that you have your protective gear on. I want to say to you, too, I'm glad that we have Ms. Neasman on I used to work for Jessie Trice in my younger years, and I had the great pleasure of working with Ms. Trice and her staff at the time. I must say that Ms. Neasman has taken um, it to a whole nother level, and the quality of services that you can get there is very important. And I want to say this last piece and really encourage Ms. Neasman to respond to this as well. One of the things that we have to be concerned about is that there have been tons of people who've been laid off or furloughed. Those folks who probably full time had insurance coverage. So now they no longer have insurance coverage. And so one of the things that we're in terms of reports that we're receiving, we know that our community is adversely affected based on the healthcare disparities. And I'd love for you to speak to this too, Ms. Neasman. And we know that one of the things that happens is that we have a high comorbidity, meaning that we have hypertension, diabetes, and such. So what happens to those people when they are no longer insured, can't pay for their prescription medications, which makes them vulnerable and that sort of thing? And you need places like I still call it Family Health Center. Please forgive me, Jessie Trice. What happened to those people? And Jessie Trice, I believe, is one of those places they can go to receive services. I'm sure Ms. Neasman can speak to that issue.
Yes, please.
Well, Ruben, thank you so much for that lead in. Jessie Trice Economic Family Health Center, as we fondly call it, we still call it that, is going to be here for the community. We are here for the community. That is our mission, is that we provide those comprehensive primary care services. And certainly we're looking at the inequities, and we have been doing that since day one, since 1967. We realize that our communities of color, and we still do serve 63% communities of color, that is African American individuals. So we are keenly aware of what our communities are facing. And let me just address as far as the COVID-19 is concerned. We are on the front lines, and we will continue to be on the front lines. It has not been widely advertised, but we are testing at our main facility. We have been doing that since March 17th. We have drive-through testing as well as we have walk-up testing. You may be saying then, Ms. Neasman, why don't we know that? Well, one of the things that you've been hearing is the lack of testing supplies, and that is a real problem for us. We have very limited supplies. We want to make sure that we have those supplies for our community. We want to make sure if individuals call, and we do have a hotline that individuals can call, and I will give you that number. It's 305-694-6268, and I will repeat that throughout. If you call that hotline and you are screened, and we screen you according to the CDC guidelines, but we are also making sure that our patients feel comfortable. Those 44,000 individuals, 45,000 that we served last year, are comfortable that they can call us and be screened, and we will be able to test you primarily at that site, but we could also do it at our other facilities where we have that testing capability. So yes, we are more at risk because we do have some of those comorbidities. We have hypertension, we have diabetes, we have lung issues, we have obesity in our community, which we have been battling these issues. I don't know, all of you on this call are very young, so you probably don't remember that in 1984, the then HHS Secretary, Margaret Heckler, put out the first minority health publication. It was actually a book on Black and minority health. And she talked about the disparities of the inequities in health that we have, and that the communities of color, what were some of the things that we had to do in order to combat these inequities. So we have been working on that, and we have certainly made progress related to these comorbidities, but we certainly still do have a long way to go when we look at the majority community. But we are here, we are testing, we are making sure that our patients are getting their primary care services.
Excellent.
Um, Jessie Trice actually went to, you've probably been hearing in the media about telehealth, uh, telephonic. We were actually doing that in our schools over almost 2 years ago. We actually started a pilot project more than 5 or 6 years ago that really, as you can imagine, during that time, the equipment was not what it is today. But we are doing telehealth. We're still seeing our patients, are calling our patients to make sure that they are healthy and that they are getting through this COVID-19 pandemic. But I cannot reiterate more of what Ruben said in protecting yourself. We must take responsibility for ourselves, our families, and our community. And the best way that we can do that with this pandemic is to follow what is being given to us as the advice. Wear your mask if you're going out in public. And we will even insist if you come to our facilities that you have a mask on. If you don't have a mask, we will provide a mask for you for all individuals older than 2 years old. Wash your hands. We in the Black African American community, we always have that saying about cleanliness is next to godliness, whatever God you serve. So wash your hands. You may have heard Dr. Fauci, the National Infectious Disease doc, say he washes his hands 100 times a day. There's a reason why you do that, in order to make sure that you're not carrying the germs or the virus, because we touch so many things in a day that we don't realize what we're touching. So wear your face mask, wash your hands, social distance. If you know that you're sick and you're one of those essential workers, stay home. You don't want to be infecting other individuals. So all of those things that we're hearing in the media and that you see on the CDC, the Centers for Disease Control and Prevention website, practice them, do them. And I want to reiterate one other thing that I know a lot of people are very concerned about, maybe that they can't get the test, that is not available to them. They may not be having any symptoms. But what we say is act as if you're positive. And that means do all those things that you would do if you were positive, which is just what I just talked about: wearing the mask, washing your hands, social distancing. You would have to do a few more things if you are positive, especially if you have others in the house with you. And we know that our community is a multi-generational community. And many times it is difficult for them to social distance or even to self-isolate from others in the family. But as much as possible, act as if you're positive.
Thank you. Thank you for that. Ruben, she spoke to testing and prescriptions. What would you say to those in our community that possibly may be facing challenges in trying to get tested, as well as even trying to obtain their prescriptions during this pandemic?
I would strongly encourage them to call the number that Ms. Neasman provided. Hopefully we can put it on the screen, to Jessie Trice. I think that Jessie Trice Center, I know for firsthand that I've referred folks who lost jobs in the past and needed, who were diabetic and needed their prescription. And they were able to go to Jessie Trice and for a very nominal fee, receive services. They received the medical attention that they needed. They got prescriptions filled. And as I said, I worked there many, many years ago. And we have a center, a healthcare center, headed by people that look like us, people who are culturally sensitive to us and our needs and understand. So they develop programs and opportunities. Dentistry, they have the whole 9 yards for folks who need these services. And that's why I'm so glad. And I thank you, Jessica, for allowing us to talk about this today and for you keeping the community informed. This is very valiant work that you're doing and valuable work. So I would encourage them to do so. I would encourage them. The other thing I want to say is that there are some other factors involved. in terms of stress. So we have a lot of folks who are under a great deal of stress right now. The virus, enters your orifices and then it goes down into your lungs and so on and so forth. And stress can really exacerbate that whole situation. And we deal with a great deal of stress in the Black community. I mean, there are reports about, the stress levels of Black women on the daily basis, how it is compared to other ethnicities, and the stress level of men. Sometimes what we end up doing is we end up self-medicating when we have those high levels of stress and anxiety. And I think that that's something that we need to make sure we stay connected to our medical systems. The reason why I think it's very important that we have Dr. Neasman on is that so folks can understand, especially as because sometimes we're leery of engaging the medical community. You often hear back folks talking about, the Tuskegee experiment and that sort of thing. And so we're leery. But to know that you go to an institution that has, since its founding, been led by powerful Black women and, and Black people, and to know that those folks who definitely have our best interests at heart, I would encourage folks to go out and seek those services. If you can't find it any place else, there is a place for you to go. And I would strongly encourage you to really think about, and I know we'll be talking about this later, mental health, the stresses that are affecting us and also exacerbating this whole thing. So when you are exposed to the virus and you're dealing with those high stress levels, I mean, it really makes you more susceptible to, being catching the virus. So I think that getting the information out, where to go. Now we know that the Jessie Trice Center is actually testing. I had no idea about that. I know that so that they won't get overwhelmed. The county is also testing, and you can call 305-499-8767 for the county. I know that they're testing at the stadium, at the Hard Rock Stadium. They're testing there. And there are several other locations. As a matter of fact, I think the county just opened up one location in Little Haiti today. So I want to make sure that we all, and you don't have to have the symptoms. These other places they're opening up the age range. If you think that you've been exposed by someone, you can go and get tested. But for those of you who have medical conditions and you require for you to have prescriptions filled and you no longer have insurance, I would strongly encourage you to follow up with the Jessie Trice Center and enroll into their programs and see if you can get the treatment and services that you need there.
All right, very good. Ms. Neasman, now if you have someone who is not currently a patient, what would they need to do to come to your centers?
Jessica, we would encourage them to call our appointment line, which is 305-637-6400. And Ruben is so right. We take all comers, whether you have insurance, don't have insurance. We do what we call a sliding fee scale. We do charge a nominal fee, starting at $25 is our nominal fee. But if you don't have any money, especially during this time, we're not seeing you because you don't have any money. Right now, again, we're not having folks walk in our sites because it's just for a routine visit. It's not considered essential. However, we can see you through the telephone or through the telehealth video capability we do have. We also, and Ruben brought up something very interesting. We also have teledentistry. We are seeing emergency dental patients, even though we're not doing routine, but we are doing teledentistry. And we also have one of our facilities open for dental emergencies. So if individuals are having dental emergencies, we can treat you for that and keep you out of the emergency room because we certainly don't want you there. And we're doing telebehavioral health. And I know, again, you're going to be talking later about mental health services, but we also have clinical social workers and psychologists on site who can help with those mental health or behavioral health issues especially during this time. For both children and adults, we have those services available. But yes, if you're wanting to be a patient of Jessie Trice, we would welcome you. Again, that number is 305-637-6400, and we can get you signed up. And certainly, we do have e-prescriptions. So if you're worried about your prescription medication, we can do that also electronically. Send your prescription to most of the pharmacies that are here in our community.
And then what would you say to our community, once again, as it relates to COVID-19? What is your call to action to them?
My call to action is take care of yourself, take care of your family, take care of your community. And what that means is if we have the morbidities that we know we have in our community, the hypertension, the diabetes, the obesity, continue to work on it. We have to work on that every day, but also don't put yourself in harm's way. Do the things that you know you need to do. First of all, if you can, stay home. Let's just stay home. We know that this is not going away for a while. So those of us who have these risk factors, let's take care of ourselves. Mm-hmm. For those of us, our young folks, let's take care of your older folks, whether they're middle-aged or whether they're elderly. Let's help protect our community. And the best way that you can do that is by wearing your mask, washing your hands as much as you can, social distancing as much as you can. And I know how severe it is to be, a lot of people say, locked up. Some of us just need that outing. And certainly, as we are hearing, our community is going to begin to open back up. But what I would say is just be careful, use common sense as it relates to this virus.
Mm-hmm. Good. And Ruben, do you have any closing thoughts for our community?
Yeah, I'd just like to echo some of the sentiments that Ms. Neasman mentioned. First of all, we need to be mindful of our family members. So in the Black community, you know, we, like Ms. Neasman said, we're intergenerational. So a lot of us live in homes where there are multiple people. So it's very hard to distancing inside a home where you have 6 or 7 people and you may have 1,400 square feet. So one of the things that I want folks to be mindful of is when you leave the house and you enter back into the home, even if you have your gloves on, even if you have your mask on, leave your shoes outside if you can, or wipe them off. Make sure you use those bleach cleaner, sanitizer things to wipe off your phones. Take off your clothes, throw them in the wash. Even if you're not washing it, just throw them in there. So when there's enough clothing in there, you can start the washing machine. If you don't have a washing machine, put them in a bag until you go and wash them. I think that we need to be very mindful that we're losing a lot of our people. And the numbers, the data, I really want people to understand this. The data that we see is only for people who are tested or people who are actually has the virus. So we don't even have half of the data. Yeah. We don't even have half of the data. So understand that with the numbers being so high, there's a lot of concerns. The other thing I want you to know is that one infected person can affect up to 1,000 people or more. So in those hot spots, when you have over 300 people that have tested positive, so you times that by 1,000. And if they're out there interacting or if they are asymptomatic, they're not even aware, that folks are being exposed to the virus through them. And so this is one of the reasons why, even though, the governor, the president, and the mayors are wanting to open back up, we stand to lose more as a people, stand to lose more lives as a people. And so that's why we have to be very vigilant. That's why we have to take those extra precautions and understand that we are living in the hot spots, most of us, in those hot spots that we have, all the way down to Cutler Ridge, Perrine, Hialeah, all of Liberty City, most of Liberty City. You got some of Miami Gardens. It's not as high there in terms of the numbers, but still, we just need to be mindful that our community is being hit the hardest, and that our mobility rate, when we die, we're dying at a disproportionate rate. We only make up like 12 to 15%, but we're dying so much more, than other folks. And so we need to make sure we take those precautions. This is a good resource for you to have. There's no excuse. So even if you don't have insurance, you've been told today, you've been given the information, there's a place for you to go. Even if you don't have insurance to buy your prescription meds, you have a place for you to go. You have a number to call to do. And even if you can't physically get there, you can be seen be treated or seen through the telephone interactions that they have. So everything is available to us now. We just need to make sure that we utilize those resources that we have. Go to those testing facilities, eat healthy food, find a way. And I'm not sure if you've been seeing the food I've been cooking on social media.
Yes, we have grilled shrimp and grilled lobster, little bits of scallions and mushroom. Yes, I have seen it. If you haven't seen it, I have seen it.
So one of the things that we can do while we're sheltering in place is just get in the kitchen with your family. Use the herbs and spices and the vegetables that you get from those farm shares, those places that you go, and just combine it with the food, the proteins that you have. We need to start practicing a change of our lifestyle in terms of eating more healthier, walking and doing things that we need to do to make us healthier, so we won't have those comorbid factors as much. So this COVID-19 is an opportunity to make things happen differently in life. And that's the way that I look at it. I think that we have time to really think and process, reinvent ourselves, take care of ourselves a lot better, get connected with family, do family fun activities together in a reasonable way, and just really, really take this time to really just reinvent and do things that are going to help propel you post COVID-19.
Yes, we have an opportunity to change the trajectory of our lives and others. And all of the tips that have been given today are worth you writing down, worth you remembering. I think we have gotten to a place where we somewhat feel a little more relaxed because we've been indoors for quite some time. But COVID-19 has not gone away. It's real. We have to be very vigilant about our health and ensuring that we are healthy so that our families can be healthy and that we can be a need. We plan on continuing to bring you quality information here at The Culture. We thank you, Mrs. Neasman. We thank you, Ruban Roberts. We applaud your efforts, and we welcome you back to the show anytime you think that you have another opportunity to spread more information for our community. We thank you so much both for joining us, and this has been another edition of The Culture.
The Culture is produced and owned by Hip Rock Star Media and cannot be reproduced or broadcast without written consent by Jessica Garrett Modkins. All rights reserved 2020.